Good afternoon, and thank you for being here today. As usual, I'm joined by Dr. Joe Cantor of the Department of Health. He will be speaking to you in just a little bit. I'm going to give an update on COVID and the latest public health emergency proclamation. He will then go through some of the gating criteria and other information, answer your questions, and then I'll come back and give you some additional updates on Hurricane Ida and our continued efforts at recovery there. There is some good news on the COVID front, and that is that we are seeing improvements in our statewide percent positivity, cases, hospitalizations. In fact, yesterday we dipped below 1,000 hospitalizations for the first time since July. All things are relative. I mean, that's much better than the 3,022 we saw at the peak of the fourth surge, but it's 4 times higher than the baseline hospitalization numbers that we had going into the fourth surge. And that's because we had fewer than 300 people in the hospital statewide before the Delta surge actually took root in the state of Louisiana. So the bad news is that there's still a very high level of COVID in the state of Louisiana. In fact, in all 64 parishes. The current weekly transmission rate is 243 cases for every 100,000 people. That's 2.5 times what the CDC would categorize as high. Dr. Cantor will go into this more in just for a moment. But I think it just bears repeating that every community in the state of Louisiana continues to have a high amount of COVID, and they're in the elevated risk category as a result of that. So we are moving in the right direction, but as I mentioned before, our baseline numbers are still far too high. We're also recovering from Ida as we continue to navigate through the pandemic. And that caused some disruptions with people moving about, with a lot of people coming in from out of state, people moving in with one another, but also we lost some days of testing, particularly in southeast Louisiana, because of the storm. And I've received the recommendations of the Department of Health, and I'm going to accept those recommendations, and so I just signed an executive order extending the current mitigation measures another 28 days. So that is the statewide indoor mask mandate, including K through 12 schools and college campuses. I think this is incredibly important, and you'll get more information on this in just a moment. But the CDC has put out information that shows that schools without masking requirements are 3.5 times more likely to have a COVID-19 outbreak than schools where children and staff and members are masked. Further, we know there's a lot less disruption to schools because far fewer children actually have to quarantine when there is a positive case identified at schools, when both the individual who tests positive and those in close proximity to them are wearing masks. The number of children infected with COVID-19 has greatly increased in the most recent surge. 7 children, you should know, died in the fourth surge, the Delta surge. And that's nearly as many as the total number of pediatric deaths that had been reported over the previous 15 months of the pandemic. We also know that children, those under 12 at least, cannot yet be vaccinated. And masks obviously help protect them. And in addition to themselves, it protects others. And that is because while it is true that most young children who get COVID-19, and this is not absolutely the case, but it is mostly true that they will not have a serious case of the disease, they are nevertheless contagious. And what we know and what you're going to see in just a moment is disproportionately transmission is being driven by people from 5 to 18 years of age. All of those people happen to be in our K through 12 school systems. Obviously, we continue to look at the fact that the vaccination rate continues to lag behind where we would want it to be. On August the 4th, the day that the mask mandate was put back into place, about 37% of Louisianans were fully vaccinated against COVID-19. As of today, that number is a little higher than 45%. Certainly that's an improvement, and I thank people who've made the decision to be vaccinated, and now we're going to start asking people to make sure that they get their booster shot as well. But quite frankly, it's not enough. And I think Dr. Walensky said it very well the other day. We're not going to boost our way out of the pandemic. We still have, I think the number given us today on the White House call was 70 million Americans who are eligible for the vaccination who've not yet taken it. Obviously, some of those individuals live here in Louisiana, and we're going to continue to do everything we can to get people vaccinated. Today, we are reporting 1,031 new cases of COVID-19. Sadly, we're also reporting 54 additional deaths, and that's a total of 13,850. So we're closing in on 14,000 Louisianans who have died from COVID-19. And I guess the saddest part for me is that for months now, the vast majority of deaths are preventable. And we know that because we know vaccinations are effective at preventing serious cases of disease and death, and that the vast majority of these deaths did not have to happen. We currently have 989 individuals hospitalized with COVID. That's actually up 5 from yesterday. This is the first time in quite a while where we've actually seen a daily increase in the number of individuals hospitalized, although it's a relatively small increase of 5, and one day does not a trend make, but it always bears watching when you see a number that comes in different than what you've been experiencing. 173 individuals are on mechanical ventilators, and that's down from 2 yesterday. To talk more about where we are in our fight against COVID and get more granular in terms of the data, I'm going to ask Dr. Cantor to come up. Please ask any questions of him that you might have while he's up here. And then when he's finished, I will come back up and we will talk a little bit about hurricane recovery.
Good afternoon. Thank you, Governor. Thank you for your leadership. Let's just start by mentioning we got word this morning that a significant amount of funding from federal HHS is going to be coming down to primary care clinics, federally qualified healthcare centers throughout the state of Louisiana that we're very appreciative of. It's going to be a total of $21 million going to a total of 33 different clinics throughout the state. So that's going to be money that's well spent, help bolster primary care, and we're very appreciative of federal HHS for granting that money. As the governor has said, we are encouraged that the trends are going in the right direction. It's clear now that we spiked with Delta sometime around the middle of August and have been making consistent progress since that time. On the flip side, as an absolute number, as a risk of what's out there currently, COVID is still high in Louisiana. And that's why it's going to be important to continue the same mitigation measures, particularly masking, that we've done throughout this surge, at least until we can get numbers down lower. We are at risk because of Hurricane Ida, and we've talked before that anytime you have displacement of people, disruption like that, sheltering, whether it's formal sheltering, in a shelter, or informal sheltering, where a family might stay with a neighbor or a friend who happens to have power or a generator, that's a risk for transmission. We have not yet, thankfully, seen any evidence in our data that transmission has picked up because of that, But it's not conclusive yet. I think we still need another week or two of data to be confident about that. All that to say, we remain at risk or liability for that. Again, very, very encouraged that our numbers are going in the right direction, but we still, at this point in time, even though we're headed in the right direction, have a lot of COVID in Louisiana, and the risk still remains high. And I'm going to walk through some data points on that. If you can go to the next slide, please. And next slide after that. This is the four quadrant slide that we've looked at a number of times now. I'm going to walk through very, very briefly on this. On the top left, you'll see COVID-like illness. This is the percent of ER visits across the state that are attributable to people presenting with symptoms that could be COVID, suggestive of COVID. You can see that we've had 4 peaks throughout this pandemic. Our first one in March and April 2020, our second one in the middle of the summer 2020, our third one around Christmas, New Year's, and then our fourth one, the Delta surge, which was clearly the largest, which has peaked around the middle of August and now has come down consistently to 4.2%. 4.2% of our ER visits this past week have been people seeking care for what could be COVID. On the top right, you see incidence. This is the number of new cases that get diagnosed every day. Again, you can see those 3 peaks very well. The very, very large fourth Delta surge peaking in mid-August. We have now been decreasing from that peak for 41 days and counting. That's very encouraging, but you'll note that where we land right now is still considerably higher, well more than double where we were prior to the start of this last surge. On the bottom left, you'll see the combination graph. The purple line on the top is testing volume. How many tests are being conducted in the state? This matters for people who want to know if they're positive or not. It matters as well on a population level, a public health level. Do we have enough visibility on the virus? Can we see clearly what the virus is doing? You see that big peak in the middle of August as transmission went up. More people were exposed, more people were sick. There was more reason to get tested, and that's why you see that big peak. We did take a hit in our testing volume around the time of Hurricane Ida. Testing sites shut down, people didn't have power, so testing volume did go down, and now you see it going back up. We still are relatively encouraged that we're doing, relatively speaking, a lot of testing in the state, and that's good. To date in September, we've